Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could take the time out and join us once again. You know, delegation happens all the time in the workplace, but all too often there are some nurses who don't participate in effective delegation and outsource some tasks to some unlicensed personnel. Now, that can cause some major risk. Our guest is returning to speak with us, and she's with the Nurses Services Organization. And as I said, she's returning with us as a guest who's very knowledgeable in how to keep nurses safe and protect their careers. Thank you so much for joining us again, Jennifer. How have you been?
Great. Thanks for having me, Neil, back on the program.
Always a pleasure. Always a pleasure. Now, you're in the business of protecting nurses' careers in such a volatile age as we live in today, especially in the healthcare industry with all the risk that even nurses are bearing now. It used to be, you know, everybody worried about the doctor when it came to malpractice and things of that nature. But now our nurses who are on the front line of healthcare are just as in the crosshairs as the physicians who are performing major surgery. Is that not right?
Absolutely. More and more we're seeing, claims against not just the primary care provider, but also healthcare providers working on that interdisciplinary team, and nurses are one of those. Yep.
Well, let's talk about this thing called delegation. Now, obviously, you know, we know what delegation is. How does that relate to the nursing industry and as that industry has to deal with risk?
Sure. So, as you can imagine, in today's age where facilities are looking to contain healthcare costs, and there's also the nursing shortage that that nurses experience and we hear about, even through news stories, it becomes more and more commonplace that nurses have no choice but to delegate some tasks to, as you mentioned, an unlicensed assistive personnel or a UAP.
What circumstances surround the delegation task to someone who's unlicensed? To me, unlicensed suggests lower level of skill than maybe the person doing the delegating.
Sure. So, nurses, they want to make effective delegation primarily so that they can delegate some typical repetitive tasks to another person at the facility, whereas they can then the registered nurse can then focus on what they've been educated to do, which is to make clinical decisions about patients and coordinate patient care. So many nurses might be confused about when and how to delegate, and really they need to look to a few things to help with their decision process and to navigate through these delegation dilemmas.
What sort of things would they need to consider?
Sure. So first, they want to look to their Nurse State Practice Act about delegation. And that Practice Act will really define what nurses can and can't do. And most nurse practice acts will include delegation as a role of the nurse. But beyond that, they'll also want to look to their facility. Does your facility policy permit you to delegate the task that you're looking to have done? And then really beyond that, what it gets into is if you're able to delegate, you have to assess the patient and evaluate the need. So you have to decide this on a case-by-case basis and whether it's safe to delegate the task. So for an example, you might delegate activities of daily living, such as feeding or ambulating, maybe even collecting data such as vital signs. But let's say in the instance of a high-risk stroke patient who requires feeding, maybe to assess feeding first to know if he or she can safely swallow before you're delegating that task. And then when you're looking to delegate that task, you have to assess the unlicensed assistive personnel's abilities. So are they capable of performing that task? And a few questions that the nurse should be asking before delegating that task are really at the core of this. So you would be asking the UAP, have you ever been trained to do this task? Have you ever performed this task with a patient? Have you ever done the task unsupervised? And then how confident are you about performing the task accurately? And then what problems have you encountered with this task in the past? And really based on these answers, you're going to decide, the nurse will decide whether to delegate and to provide that supervision while the UAP performs that task. So all of these, issues come into play when we talk about delegation.
You talked about each state having these best practices for nursing as it relates to delegation. How closely are these best practices related to legal practices? And that question being posed, are there certain practices that are only best practices and certain other things that are covered by law?
Well, where the legal system comes into play is that if the nurse is ultimately, they might be delegating the task, but ultimately they're responsible for the outcome of that patient. And so they're going to be asking themselves, and what a legal system would ask is, what would a reasonably prudent person done in this similar situation? And so, based on that, they, can look to even common cited definitions of what the American Nurses Association and the National Council of State Boards of Nursing developed sort of a guidelines to assist nurses in making these delegation decisions. So you may have heard of the 5 rights of delegation: right task, right circumstance, right person, right supervision, and right direction and communication. Well, all of these guidelines come into play in both the outcome for the patient, and if there was to be an injury, it would also come into play in a malpractice lawsuit or even a disciplinary board complaint.
I believe that there's a magic number that physicians have to hit on a certain procedure, whether it be a heart transplant or whatever, in order to be considered, proficient, at least by the hospital that employs them. Is there anything similar when it comes to covering yourself when you're delegating? As far as see if someone's competent or do they feel competent, is there any type of system where you can go to someone and say, hey, this person has been documented as having given this injection 400 times, as an example? Is there something like that exists?
Today, there's not really a template that exists that would be like that. It's really just the that communication and that assessment that comes down to it with the nurse, as well as, how they are viewing the task that needs to be completed, as well as the person that they're delegating it to. So certainly with a nurse's experience, you might get in the habit of delegating these tasks. But at the same time, it's really on a case-by-case basis. And even if you've worked with someone that you've delegated tasks to in the past, it really shouldn't be something that a nurse it gets lax about in terms of asking those same questions each time there's a task to be delegated. So not really based on a template, I would say, but just that you are, with each patient, you're approaching each task delegation with a consistent approach. So when you're getting ready to delegate that task, that you're going through those questions with the person that you're delegating each time. And even so, I would even go beyond that to say that even when a patient's condition might change, that you're going through that decision-making process again before you should or should not be delegating that task, even if you had done it in the past.
Where can our listeners go and get some more information about NSO?
Sure. So NSO, there's a ton of risk management information on our website, www.nso.com, as well as webinars that we host. and articles and legal cases that you can find more information on this.
Well, once again, it's been very informative. Thank you so much for coming back on the show, Jennifer.
Thanks, Neil. Thanks for having me.
Great. Looking forward to our next conversation.
Great. Me too.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.